Okay, well, I think we'll get started with our webinar, and thank you for your interest in the program. The purpose of the session is really to hopefully provide you with some clarity on this program. There's been some changes since we've run the first pilot, or we're currently in the first pilot, and to offer an opportunity to answer any questions you might have. So the presentation itself will be about a half an hour or so, so that'll provide ample time to respond to questions and queries that you might have. So first off, how did this program come about? Well, the Association of Canadian Dental Faculties of Canada, or ACFD, was awarded a federal grant to develop this new pathway for licensure for internationally trained dentists. So the project started back in 2024 and will run through to January of 2028. The first 2 years of the project was really to develop the elements of the program, and in the last 2 years of the program are to run pilots. So the first pilot already started in September of 2025, and the candidates in the first pilot are now already in the second part of that. And the second pilot, which would be the ones that you folks would be applying to, will be starting in the fall of 2026. So the goal of this program is really to identify internationally trained dentists whose training needs or for successful entry into dental practice in Canada can be completed within 8 months. So up till now, there's really been two pathways for internationally trained dentists to become licensed in Canada. So one pathway was through the National Dental Examining Board equivalency pathway, which, as I'm sure most of you are familiar with, was a series of examinations leading to the point where if you're successful through all those different examinations, you'd be eligible to write the virtual OSCE, which is what the domestic students who graduate through Canada write prior to licensing. The second pathway, of course, would be to do what we call an advanced placement, or some universities call it a qualifying program, which would be you would join either the second or the third year of a DDS program, complete the program, and then you would graduate with a degree from Canada, and again, be eligible to write the virtual OSCE. So this third pathway really is intended to identify a group of people that would benefit from some additional training before they enter practice in Canada. But it would also then not mean you'd have to spend the full 2 to 3 years basically retraining again. So through completion of this program, you would be able to move directly to the virtual OSCE. So the learning scope for this program really is intended to fill a gap between what has been tested by the AFK and the ACJ assessments through the National Dental Examining Board to the point where you would be at the same level as the graduates from Canadian schools. And that is really meeting what is considered the KSAs, or the knowledge, skills, and abilities that are required for a beginning dental practitioner in Canada that are defined by the regulators in Canada. So that's the scope of learning in which we're dealing with for this particular program. So the program will be up to 8 months in duration. There'll be one intake of students per year into 3 sites. So the 3 sites are the University of Alberta, Dalhousie University in Halifax, and Université Laval. I probably didn't say that too well, but I call it Laval University in Quebec. So each of these sites will take up to 10 patients or 10 students. And the program is set up to be a full-time on-site program running on weekdays, and your person would actually have to be in person for it. So the program will include core modules for all individuals, which are establishing the professional cultural context for practicing dentistry in Canada. And then there'll be individually required modules as appropriate based on the critical skills and learning gaps that are identified through assessment. The training modules will include summative assessment, and so successful completion of the training modules will be necessary to be able to complete this program. And again, these modules are really designed to evaluate the students' capacities to enter practice as defined by the KSAs in Canada. So we're very proud of the fact that the this ACFD Bridge Training to Dental Practice of Canada program has now been officially accredited. It has what we call preliminary accreditation status with the Commission of Dental Accreditation of Canada. And this is for all three sites for the pilot. This is a very important milestone because what this does is allows the candidates to go through this program and complete it to move on directly to the virtual OSCE at the completion of the program. Since we also have now people that would complete this program would not be required to do the NDEC, we've also expanded the eligibility window so that candidates entering this program now would be eligible to apply if they've completed the ACGA assessments within 5 years, whereas before it was 3 years. So we'll talk a little bit about the training modules because they've changed a little bit as we've been running this first pilot. So each of these modules is designed and it's tailor-made for internationally trained dentists. So they're very specific for people in your cohort. And the emphasis is really on the variations for Canadian context and practice guidelines in Canada. So the modules focus on building competencies for the real world and not simply passing an examination or the NDEC, which would be the equivalency pathway. So the domains from the KSAs for beginning dental practitioner in Canada have informed the defined topic areas for each of these modules and their associated scope of practice. Each of these modules has varying time intervals attached to the module based on the learnings objectives for that particular module. So the way the program has been designed now moving forward for the second pilot, which will be starting in September of 2026, we now have 9 what we call core modules, which every person taking this program will need to complete. What makes this program unique is that these modules are centered around patient care, cultural competency, and the human skill side of the program. The classes will be a mix of lectures, labs, clinic, and simulation time. So in addition to the core modules, there's also 4 individualized modules, and these would vary depending on what we find during our assessment phase. And individuals will be required to take modules depending on what is the outcome of the pre-entry assessment. So these individualized modules could vary between candidates. What we really want to highlight is that the program has also shifted, and so there's now a much bigger emphasis on clinical experience built into the program. So students will be immersed in a clinical environment where they'll be able to provide patient care, and this helps develop the clinical competency across all of the dental disciplines. It is in a supervised environment. Students will be working with instructors within the programs. And so there will be that mentorship and feedback. Students will be keeping a portfolio of the clinical experiences, which is part of the evaluation process that we'll be working through in terms of successfully the clinical components. And the areas that we'll be assessing is patient assessment, provision of care, and maintenance of professional standards as we move through it. So just give you a little sense of comparison between the bridge training program and the other programs. So the bridge training program does not grant a degree, so that's important to understand. Whereas if you take one of the qualifying or advanced placement programs offered at the universities where you take 2 to 3 years of training, do complete a degree. With the bridge training program, there is clinical training involved, not as much training as a person would receive in the qualifying programs, but as compared to the equivalency pathway through the National Dental Examining Board, which has no clinical training, it is an important separation. The bridge training program is really intended to prepare one for practice in Canada, similarly to the qualifying program, which does prepare one for practice in Canada. But the National Dental Examining Board equivalency pathway is not intended to prepare you for practice. It's really around passing specific skills. The cost for participating in this program is less than what it would be, obviously, with a qualifying program where you would spend 2 to 3 years in school. And with this program and the qualifying program, once the person has completed the program successfully, they'd be able to move straight through to the virtual OSCE process, whereas and the duration, of course, in this program is 8 months, and the duration of going through the National Dental Examining Board can vary quite significantly depending on how many times a person writes and how frequently they're taking them. So we'll talk now a little bit more about the admissions requirements and the admissions process. So there's three phases to the application process. There's the eligibility in the application, which we'll talk about. There's also language proficiency in an interview, and then the skills and knowledge pre-assessment before actually entering into the program. So in order to be eligible to apply for the program, you first off have to be a graduate of a program that has a minimum of 4 years of university that's not recognized by the CDAC. You have to be a Canadian citizen or a permanent resident of Canada on or before you would apply for the program. You have to have passed within 60 months the AFK and the ACJ examinations to the National Dental Examining Board pathway. You must meet all of these requirements before you can be considered to be eligible for the program. And as part of the application, you provide consent for AFK, the ACFD to request the documents from the National Dental Examining Board, which is really the outcome of the ACJ and the AFK examinations. And if you've done the NDEC, we will also request the scores from the NDEC. Important to emphasize, of course, you don't have to pass the NDEC to be able to be qualified for this program. We also will be asking you to tell us which site you would prefer to go to. You need to provide your curriculum vitae and citizenship, and these will be uploaded as PDF documents within the application portal. We will ask you to provide information regarding your past experiences, both academic training and clinical experiences. And these experience documents would be provided in less than 300 words. And you'll be filling out fields within the application portal. You do not need to provide letters of reference, but we will request referees that we can contact to verify information. And you'll need to go through the language proficiency, which we'll get into in a bit more detail in a minute. So with regards to language proficiency, there's really two options providing evidence for language proficiency that's required for eligibility. One option is to be able to demonstrate that you've had official university level training in either English or French. And this could be done at a Canadian university, or it could be done at an international university where English was the primary or French was a primary language of instruction. It's important to understand, of course, that we will only consider courses that are taught primarily in one of the two official languages of Canada that are taken for credit. We will not include failed courses, and we will also not include English Language Learner or ELL courses when we're considering it. All of the years do not need to be completed at one institution, so you can complete years of instruction in one of the official languages at different institutions and still be eligible. The other option is to complete one of these language examinations, and I'm not going to go through these in detail. They'll be available on the website, but in English, the TOEFL or the IELTS, and in French, of course, there's two different ones that would be considered eligible if you're successful in completing those. Important to understand that these have to be completed and no older than 2 years from the application deadline. They have to be valid and verifiable. So after you complete your application, then we move on to the next phases of the intake process. And there are really going to be 3 steps. So the language assessment, which is really a conversational language assessment, interview process, and then the pre-entry assessment of knowledge and skills. So the language assessment is really intended to understand your ability to be able to converse in one of the official languages in Canada at a level required to be able to practice dentistry in Canada. This is completed online and it's run by the University of Alberta group. The second part will be the interview process, which is conducted as what we call a multi-mini interview process. It's a series of questions that you'll be asked that are intended to evaluate critical thinking, decision-making, communication skills, interpersonal abilities, compassion, ability to work as a team, and other things. So it's really a series of discrete short questions, and these are recorded online, and then they're evaluated by a group of evaluators. The interview questions that will be part of this MMI are specifically designed for internationally trained dentists. So the admissions committee will take into consideration, the factors in terms of who will move on to doing the pre-entry assessment. So it'll be looking at the performance on the ACJ and the AFK, the language assessment scores, and the MMI scores. So from those, candidates will be offered the opportunity to attend for a pre-entry assessment. And the pre-entry assessment is really designed to identify the individual candidates' areas where there's critical skill deficiency that could be potentially trained within 8 months in this program. So based on the results of the pre-entry assessment, you can either be accepted into the program. We would identify non-core modules that you'd be required to take during the program. But it's also possible that during the pre-entry assessment that it may be determined that you're not really the right candidate for this particular program, would be better suited to consider one of the advanced placement or the qualifying programs at the universities. So the pre-entry assessment's really to identify your areas of strengths and weaknesses relative to the areas that are being assessed through the KSA document for the beginning practitioner in Canada. So once we've completed the pre-entry assessment, we've determined which candidates would be appropriate for this particular training pathway. Once you're offered a position, you'll be required to make a deposit. That's a non-refundable tuition deposit, and that will have to be deposited within a time interval that's specified in the letter of acceptance. The deposit will be credited towards payment of the tuition once you begin to attend the program. There's also a requirement for immunizations, and these need to be completed and fully documented before starting the program. These requirements, again, will be outlined in your letter of admission. And it's important to note that these vaccination requirements can vary from province to province. And it's also important to understand that it can sometimes take a number of months to be able to get all of the immunization necessary to complete requirements. So it's very important that you're on top of this very early on. The other thing that's required as part of the admission, once you've been offered a position, is to have a police information check. So this is including a vulnerable sector check, which is required by law within Canada. And the check has to be completed within 6 months of the program start date. So this is just the timeline. So the application portal opened yesterday. The application portal will close at the end of February. And then we will begin with the conversational language assessment for those that have completed all of the requirements for application. And that'll be followed by the interview process. And then from there, candidates will be offered the pre-entry assessment in April. So when you'd be notified, and you'd have until the end of April to accept the opportunity to come for the on-site assessment. So the dates that have been established for the pre-entry assessment at the pilot site that you would want to attend would be in May, at the beginning of May. And candidates who have completed that would be notified by the end of May that they would be successful. And then the deadline to be able to complete and accept your position would have to be done by the end of June. And then the program would start in Alberta, it would start August 17th, but at the other sites, it would start at the beginning of September. So these are the program fees for the program that'll be starting in the fall of 2026. So there will be an application fee of $500. The fee for completing the pre-entry assessment would be $1,000. And then once you've been notified that you'd be accepted into the program, there'd be a deposit of $3,000, which again would be applied to the program fees, which is $30,000. So it's important to also recognize that these fees are being supported by government grant. And as we move past the pilot projects, these fees are likely subject to change when we fully understand what's involved in delivering. So what are the benefits of this particular program? First off, it's really important, and we feel this is probably the most important benefit, is that it's really truly preparing you for practice within Canada rather than preparing you to pass an examination. There's definitely financial and time savings compared to going through one of the 2 to 3 year qualifying programs at the university. And there's also the opportunity to go directly to the virtual OSCE without having to go through the NDEC examination. So just a couple of sort of final comments here. It's important that we fully understand that this isn't a retraining program. It's really intended to provide context for practicing in dentistry in Canada. The program is still in its development and pilot phase, which then results in fees that will be lower than they're likely to be after the program is fully up and running and offered by multiple universities. There have been significant changes to the program from the first cohort that went through, and the big change, of course, is that there's been a dramatic extension and expansion of the clinical training portion of the program, which I think is very important. We've also got our preliminary accreditation in place, which is allowing us to bypass the NDEC assessment. We've reformatted the modules based on what we've learned from our first pilot cohort. And it's also important that understand that this program has been put together by a collaboration of 7 of the dental schools in Canada. So we've had subject matter experts who are really truly at the very front of their field in developing this training program. So that's the end of the presentation. I would like to open it up for questions.